Hi, I'm Chris Labaki from the Dana-Farber Cancer Institute, and I'm going to talk today about our work recently presented at GU ASCO 2022 regarding the changes in screening, diagnosis, and the management of genitourinary malignancies during the COVID-19 pandemic. In our previous studies, we evaluated cancer screening during the COVID-19 pandemic, and we identified a sharp decline in all cancer screening modalities during the pandemic, followed by a pattern of partial to progressive recovery. We intended to evaluate specifically genitourinary malignancies regarding their diagnosis, their surgical management, and when applicable, their screening modalities. So we looked at the most common GU malignancies being prostate cancer, bladder cancer or urothelial carcinoma, and renal cell carcinoma or kidney cancer. We evaluated the new diagnosis in each cancer type and the changes in the surgical management of these malignancies, meaning nephrectomies, prostatectomies, and cystectomies. And we evaluated also the screening for prostate cancer and the cystoscopy for urothelial carcinoma or bladder cancer. We evaluated this data in the Mass General Brigham Network, which is the largest healthcare network in the northeastern United States and which encompasses a large proportion of Massachusetts population. Overall, we looked at all the time periods ranging from March 2020 until March 2021. Each time period will correspond to 3 months, so we had a total of 4 time periods during the pandemic, and we compared the numbers across the different evaluated modalities as opposed to the pre-pandemic period, meaning the year ranging from March 2019 till March 2020, and more specifically, the immediate pre-pandemic period ranging from December 2019 to March 2020. So overall, we identified across all screening, diagnostic, and therapeutic modalities a sharp decline, which is overall very alarming in the early pandemic, meaning from March 2020 till June 2020, where this decrease would range up to minus 65%, and it would be more highly seen among screening modalities, meaning PSA, and it would be less important among surgical therapeutic modalities, meaning cystectomy, prostatectomy, and nephrectomy. This overall shows a pattern of prioritization of care where surgeries will still be performed, although at a lower rate, but without a very high decrease. Afterwards, during the subsequent time periods, we saw a pattern of progressive recovery among the different modalities that we evaluated, whether it would be screening, diagnosis, or surgical treatment of GU malignancies. And the numbers that we saw were even higher than those that were reported before the pandemic. This means overall that our healthcare system was able to adapt to the pandemic. And with numbers of procedures, diagnosis, and all modalities related to the management of GU malignancies even higher than those that were seen before the pandemic. This is reassuring. Overall, our work adds to the current body of the literature evaluating the changes in the healthcare system during the COVID-19 pandemic. And one important question which we are still evaluating is whether we are able to diagnose GU malignancies at an early stage with similar rates as compared to pre-pandemic normal time periods, or whether patients are presenting at a later stage, meaning they are presenting with more advanced disease and potentially worse outcomes.